Hello everyone. The topic we cover today is antidepressant and anti-manic drug. So both which comes under the psychopharmacological agents, and one of the other psychopharmacological agent, that's antipsychotic. Already we have discussed in another video. So today we'll see the antidepressant and anti-manic drug. So first we'll go to the antidepressant drug. The word itself, it indicates that antidepressant means it's the drug which is used against the depressive condition. And while coming to this antidepressant drug, it is otherwise known as thymoleptic drug and mood elevator. Why? Because in the depression, the patient will be having reduced mood, and this drug will increase the mood of that particular patient. That's why it is termed as a mood elevator. And the first antidepressant drug, imipramine, it is a tricyclic antidepressant. It is used in the year of 1958 by Thomas Kuhn. And now we'll move to the antidepressant drug. So what are the classification or what are the types of antidepressant drug? Antidepressant drug are classified into TCA. That's a tricyclic antidepressant. So imipramine and amitriptyline, these are the examples for TCA. And the another classification is monoamino oxidase inhibitors, or MAOI we'll call. Isocarboxacid is the example for this one. Then SSRI, selective serotonin reuptake inhibitors. Fluoxetine and sertraline, both are the example for this one. Then there is another one more classification, atypical antidepressant. Amineptin is the example for this group of drug. Now we'll see the mechanism of action. So while coming to the mechanism of action of antidepressant. So the antidepressant drug, it is believed that this particular drug which will enhances or which will increases the level of norepinephrine and serotonin in the synapse, and thus the patient's mood or the activities will be increased. This is the mechanism of action. Now we'll see the pharmacokinetics. So while coming to the pharmacokinetics, this drug also will be absorbed well in orally, then the metabolism usually in the liver, and it may be excreted through the kidney. Now we'll move to the indications of antidepressant drug. So while coming to the indication, the major indication is the depression. So it may be cyclothymia, or it may be major depression, or it may be bipolar affective disorder. So any type of depression, the antidepressant can be administered. That is the major indication of antidepressant drug. Apart from this one, there are certain childhood psychiatric disorders like enuresis. Enuresis is nothing but we call the bedwetting. Enuresis, school phobia, separation, severe separation anxiety disorder of the child. So these are the condition, child psychiatric condition, we can go for antidepressant. Then certain other psychiatric condition like what we can say severe OCD. Then it may be like severe anxiety disorder, panic attack, phobia. Okay, agoraphobia mainly, we can say in that condition we can go for the antidepressant drug. And apart from this one, certain medical condition, especially patient is having chronic pain like a cancer or something, in that case we can go for a mild dosage of antidepressant drug, as well as migraine. In case of severe or chronic migraine, in a low doses of antidepressant can be administered to the patient. So these are the indications of antidepressant drug. Now we'll move to the side effect of antidepressant drug. While coming to the side effect, we can say autonomic side effect. So in the autonomic side effect, it may be the dry mouth, constipation, urinary retention. Then in case of males, it may be impotence and impaired ejaculation, mydriasis. So these are the autonomous side effect of antidepressant drug. Then it is having certain CNS side effect. In the CNS side effect, you can see there is this drug which produces sedation. The patient may be having seizure activity, and another important one which causes a withdrawal symptom. Means the patient continuously using antidepressant drug, suddenly or immediately if he stops this one, the patient may be developing certain withdrawal symptom. Then certain cardiovascular symptoms may be produced. In the cardiovascular side effect, it may be arrhythmias will be there, or if there is any changes with the ECG or ECG changes we can observe in this particular antidepressant side effect. Then another side effect is nothing but the what we can say hypersensitivity reaction or severe allergic reaction. So these are the side effects of antidepressant drug we can observe with the patient. Now we'll move to the nurse's responsibility. While coming to the nurse's responsibility, the patient may be having already the patient having autonomic side effect like dehydration, dry mouth, or we can say constipation. In that case, you can offer fluid diet, or you can ask, or you can offer the patient like fruit juices. Frequently, you can give ice chips or lemon pieces. You can give to the patient, because all these things which reduces the dry mouth, or it can increase the fluid level of the patient. Then if the patient is having constipation, you can offer fiber-rich diet to the patient. Then advise the patient not to go for driving, not to go for swimming, or not to use hazardous medicine, because these drugs may produce severe sedation. Now we'll move to the anti-manic drug. So the word anti-manic drug, that means these are the drug which is used to treat the manic condition. That's why the term anti-manic came, and it is otherwise called as mood stabilizer. Why we call mood stabilizer? Because in the manic case, the patient's mood will be increased. To stabilize, to reduce that mood, we'll give the anti-manic drug. And usually there are three types of anti-manic drugs are there. One is lithium. There are certain types of anticonvulsant drug we'll be using, carbamazepine and sodium valproate. Then certain atypical antipsychotic drug like risperidone will administer to the patient to reduce the mood, or as an anti-manic drug. And mainly we'll see the lithium, because lithium is a commonly using anti-manic drug. So while coming to the lithium, so this lithium, it is identified by, or initially it is identified by Arfudson, and it was mainly used for the treatment of gout. And later, in the year of 1949, it is rediscovered by F.J. Cade, and it is an element having atomic number 3 and atomic weight of 7. And while coming to this lithium, the mechanism of action, exact mechanism of action is unknown for this lithium, and it is thought that it reduces the level of norepinephrine and serotonin. So this is the mechanism of action. And while coming to the indication, mainly it is used for the manic cases, any type of mania like a hypomania, mania with or without psychotic symptoms. And apart from this one, if the patient is having a violent behavior, or as a prophylaxis for bipolar affective disorder, we use the manic drug. And it is having certain side effect. The side effect may be like digestive side effect, digestive system side effect. It may produce nausea, vomiting, and patient may be having anorexia, loss of appetite. And apart from that one, it may be having severe allergic reaction, and it may change certain ECG changes, and it may cause polyuria, polydipsia. And the main side effect of lithium is lithium toxicity. So while coming to the lithium toxicity, the normal therapeutic level of lithium is 0.6 to 1.2 milliequivalent per liter. That is the blood level. And if you come to the toxic level, we can say if it is exceeding more than 2 milliequivalent per liter, it produces the toxicity. In the lithium toxicity, we can observe the patient may be having nausea, vomiting, then it may cause a blood vision, patient may go for syncope, and in severe cases like ataxia, lack of muscle coordination, we can say, and it can go for coma and death. So that is a severe complication of lithium toxicity. And if there is any lithium toxicity, we can observe the lithium toxicity with the patient, and you can report to the higher authority, and we have to go for IV fluids, stomach wash, stop the administration of lithium to the patient, and go for serum lithium level, examination of serum lithium level. And there are certain nurses' role is there. So while coming to the nurses' role, so observe for the lithium toxicity symptoms, okay, any side effect of lithium toxicity, and the close observation, monitor the vital signs of the patient, and if there is any lithium toxicity, immediately inform to the higher authority. And these are the what we can say important drugs. It comes under the psychopharmacology, that is antidepressant and anti-manic drugs. And while coming to the anti-manic drug, so the dosage of lithium will be 300 mg per tablet, and usually will be giving 900 to 1200 to the patient per day. Okay, so that's all for today's class. This is Vishant signing off till we meet the next class. Thank you.